Hello, my name is Morgan. I'm a former veterinary nurse and I'm here today to start my rabbit medical series, and in today's video we are going to be discussing spay and neuter. As I mentioned, I worked in the veterinary field for about 6 years as a VA, and I did work in clinic with rabbits. I also went to school for pre-veterinary medicine, so I do have a medical background. However, I do want to disclaim that I am not a veterinarian. You should always consult with your veterinarian as your #1 resource before following anything that you hear online. Now, you may notice me looking down once in a while, and that's just because I have some notes on my laptop, so I apologize if that is distracting. Now, the first thing that I want to talk about is spay and neuter in general for rabbits, because a lot of people, especially those who are new to rabbits, don't actually know that it's standard practice to have your rabbit spayed or neutered. It's really important to take this into consideration before you get a rabbit, especially if you are looking at purchasing a baby rabbit. This is another chance for me to plug adoption, so I'm going to do that here. I have 2 adopted lop rabbits and they are fabulous. They're both about 2 years old and we are working on pre-bonding right now. I am going to have a video on that later. But I just want to plug adoption because both of my boy rabbits were already neutered when I got them, and the one that I got from a state rescue was already vaccinated. So these are things that you may want to consider when you're thinking about getting a rabbit, because spay and neuter is a large expense. And that's the first thing that I want to talk about. The expense sometimes sneaks up on new rabbit owners because when they get a rabbit, they're not aware that spay and neuter is standard practice. As I mentioned, the expense is something important to keep in mind. I believe that the House Rabbit Society has an average price around $250 right now for the spay or neuter surgery, at least in my area, and I live in Florida, and I've called around some other southern states like where my parents live in North and South Carolina, and those prices are ranging closer to about $400 to $600, and the spays are going to average about $100 to $150 higher than neuters. There are low-cost spay and neuter options in certain states, and some rescues also have vouchers for spay and neuter, so it's definitely worth calling around and seeing if there are any low-cost options. But it's also important to make sure that you are getting a vet that is rabbit savvy and not just a small animal vet that also sees rabbits. You want to try to find an exotic vet if you can. They are few and far between, so it's just important to try to find a veterinarian that you trust and that you feel is knowledgeable about rabbits. And I am going to go over it later in this video how to vet your vet to make sure that they are actually rabbit savvy, and a few red flags that may tip you off that this veterinarian is actually not as comfortable with rabbits as you may want them to be. So again, it's just really important to keep the expense in mind, especially if you haven't gotten your rabbit yet and you're just considering it. It's great that you stumbled upon this video because, again, a lot of people just don't know that you are supposed to spay and neuter your rabbit. So this may be a deciding factor for you if you don't want to spend $400 to even up to $800. I've heard Canadian and UK prices are even higher. So this may be something that would tip your scale toward adoption rather than purchasing a baby rabbit. So one question that you may ask yourself is, should I spay or neuter my rabbit? Well, there are a few questions and things that you may want to think about. It's my opinion, working in vet med, that yes, the benefits far outweigh the risks of the procedure. A large portion of people that are still deciding if they want to do it are just not sure because rabbits are very sensitive to anesthetic, and that is one of the reasons that people are nervous about the procedure, and that's a completely valid concern. Choosing to spay or neuter your rabbit is a personal decision. If you have done valid research and you've done a deep dive and you're able to weigh your options and take into consideration your situation or your particular rabbit, it's completely a personal decision whether you want to have your rabbit spayed or neutered. I don't agree in any way with people berating each other about their personal decisions because this is your pet, so this is your decision to make. And I think the best that you can do for your pet is to just make sure that you have all of the information and that you make the most informed decision for you. Now, I will say that it is recommended by veterinarians and it is considered standard practice. The number one reason that your vet is going to advocate for spay and neuter is due to the very high percentage of rabbits that will contract reproductive cancers during their life. Rabbits are susceptible to reproductive cancers, with about 50% of intact female rabbits developing some kind of reproductive cancer throughout their life, and it typically arises around age 5. Because rabbits are so delicate, cancer is a really tough diagnosis for them, and typically rabbits that are diagnosed with cancer do not live very long past the diagnosis. So in essence, there's a potential that not spaying your female rabbit could land you with a 50% chance of your rabbit not living past around the age of 5 or 6. Male rabbits are also prone to testicular cancer, but it is a little bit more rare than it is in females. Typically, the reason for neutering male rabbits is due to aggression, spraying urine, and reducing the pungent odor of their urine. Female rabbits are also prone to aggression around that age of sexual maturity at about 4 months. They can also become very territorial, and males and females can both start to fall out of their litter habits around that age of sexual maturity. So if those are becoming problems for you, you may want to consider spay and neuter. Another reason that you should consider spay and neuter is if you hope to get another rabbit or have a bonded pair at some point. Bonded pairs are always recommended because rabbits do better when they have a partner. This is a general statement, of course. Some rabbits don't like other rabbits, and some rabbits just do better as an only rabbit, and that's completely fine. If you do plan to have a bonded pair, the highest success that you're going to find is when both of those rabbits are fixed. That doesn't matter if they're both females or if they're both males. Having them spayed or neutered will reduce some of those territorial tendencies because rabbits are very territorial animals, and it just takes out the risk of hormones getting in the way of them forming a strong bond. Bonded pairs that are fixed are much less likely to get into serious fights or get serious injuries when they do have scuffles. So it is highly, highly, highly recommended that if you're planning on having a bonded pair, that both of them are fixed. And this is something that I strongly believe in. There are situations when intact females and sometimes intact males can get along, but it's really few and far between, and you're taking a pretty big risk by taking the chance on getting two intact animals and putting them together. And of course, if you have a male and female pair, you don't want to put them together because they will have babies like every 28 days. So definitely do not want to do that. Another thing that you should consider are the potential risks. Now, rabbits are much more sensitive to anesthetics than other animals that we're used to spaying and neutering, like dogs and cats. The death rate for rabbits during this procedure specifically is about 1%, which is pretty low. However, it is a lot higher than the 0.005% in dogs. And these statistics are for healthy patients going into surgery. Of course, if your rabbit is sick or has any kind of medical condition, this percentage will increase, so make sure that you consult very closely with your veterinarian when you're considering the procedure. I also highly recommend having a blood work panel run on your rabbit to test for organ function, because this will give your veterinarian a snapshot of what their organ function looks like and what they can handle under anesthesia. These types of pre-surgical lab works will reduce risks during surgery. Now, just like I talk about the risk, I also want to talk about the benefits. Now, in my opinion, working in vet med, the benefits far outweigh the risks, especially if you have a really talented veterinarian who is super comfortable with rabbits. Now, again, the benefits include reducing the risks of reproductive cancers, which are incredibly common and can be life-threatening. It also reduces undesirable behaviors like poor litter box habits, spraying urine for males, and urine odor, and that includes in both females and males. If you're noticing a really pungent odor in your rabbit's urine, it could be due to hormonal issues. So it is definitely a good idea to explore the option of spay neuter if you're noticing some of those problems. And other behaviors that it can reduce is aggression, territorial behaviors, and marking behaviors like leaving little poops all over the place. Those are marking behaviors and doesn't necessarily mean that your rabbit is not litter trained. They're just behaviors that can occur due to hormones. Now, I have a list of questions here to help you vet your vet. Here are a couple of questions that you should ask your veterinarian, and watch out for certain answers because they may allude to you that your vet is not as rabbit savvy as you may want them to be. So the first question is, do you recommend fasting before surgery. Now, I've heard this a couple of times on a couple of groups that I'm on social media, where people have said that their veterinarian has told them to fast their rabbit. The answer to this should always be no. If your vet says yes, run. Find another vet. That vet does not know what they're talking about. Rabbits should never, ever be fasted for any reason. The reason that veterinarians will tell you to fast a dog or cat before surgery is because they want to reduce the risk of aspiration during surgery, which is vomiting. Rabbits can't vomit, so there is no need for fasting. The more your rabbit eats, the healthier they're going to be. So you want to make sure that your rabbit is eating well before surgery. This will keep your rabbit's system functioning during surgery and will make them less susceptible to any bad reactions to anesthesia. Question 2 is, do you recommend pre-surgical blood work? As I mentioned before, this gives your vet a better snapshot of what your rabbit's organ function looks like. Now, this one doesn't have a specific yes or no answer. Some veterinarians may want you to do it and some may not, but if you trust your vet, you may just want to go along with their recommendation. However, I always recommend it if you can. Another question that you should definitely ask your vet is, how do you anesthetize? So there are 2 ways of administering anesthesia. The first one is via intubation. This is the plastic tube that goes into your mouth during surgery to make sure that you are getting oxygen and getting your anesthesia. And the second means of anesthetizing is via gas or through a gas mask, and some vets will call it the box down method. This method is not recommended for rabbits because it can increase the risk of bronchial spasms during surgery, and it can also cause oxygen deprivation that can result in death days after surgery. So your rabbit may come out of surgery seeming just fine, but the risk of mortality after surgery is higher with the box down method. A reason that a veterinarian might lean toward gas or box down method is because they are not comfortable with intubation. This might be a red flag that your vet isn't rabbit savvy and that they are not skilled enough to properly intubate the rabbit. Intubation can be really tricky for rabbits, and some veterinarians that are not as experienced probably won't be comfortable intubating. So this is definitely a good way for you to tell if they have done this procedure often and if they are actually rabbit savvy. And the last question that you should ask is, do you provide pain meds after surgery? The answer really should be yes, unless your rabbit has an underlying medical condition. Pain meds highly reduce the risk of GI stasis after surgery, and I will talk about that in just a little bit when I talk about post-op. But it's really important to make sure that your rabbit is on pain meds if they can be, because it will reduce stress and obviously pain and inflammation following the surgery. Now we're going to talk about pre and post-op care. Now, at my previous clinic, my doctor always recommended starting a course of critical care. Critical care is a supplementary food that can be given to rabbits and other small animals following surgery, and it is typically a food that is force-fed via a syringe. It's definitely a good idea to go ahead and purchase some before your rabbit's surgery so that you can make sure that you have it on hand, especially for post-op. But this is just a little trick of the trades that I learned that can possibly make your rabbit more open to taking critical care when it's needed. So one of the old vets that I worked for recommended to go ahead and put some critical care mixed up onto a plate or in a dish and just let your rabbit eat it. That way they're not always associating the smell of it with illness or injury. Critical care is really yummy for them. It's just a mixture of fruits, nutrients, and basically ground up pellets, and it's in kind of like a paste-like form. So it's good to get those positive associations going and get them familiar with critical care before surgery. And you can start feeding this the day prior to surgery just in a dish. You don't want to try to force feed when your rabbit doesn't need to be force fed because you don't want to cause any stress before surgery. This is just a good preoperative measure to take to reduce the risk of GI stasis following surgery. A few other things that you'll want to keep in mind is to make sure that you clean your rabbit's enclosure while they are at the vet so that when they come home they have a really clean area to come home to. And if your rabbit is free roam, you'll want to fence off a small area in your home for at least a few days while they recover. You want to reduce running, jumping, and anything that could potentially cause them to pop a stitch, and you basically just want them to lay low for a couple of days. You'll also want to make sure that you have a carrier that you can take them to the vet in, and you can line this with a fleece blanket or a towel. Now let's talk about post-op care. As I mentioned, you'll want to make sure that your rabbit's post-operative healing area is completely clean because you want to reduce any risk for infection. When you're cleaning your rabbit's space, you want to make sure that you're not using any harsh chemicals. The best thing to use is a vinegar and water solution. Again, you will want to have your rabbit in a small confined area for at least 24 hours following surgery. Males tend to start feeling better within 2 days, and females will fully heal in about 4 to 6 days. Now, it is normal for your rabbit to not want to eat following surgery. It's pretty normal for them to not eat for about 6 hours following surgery due to the pain. As I mentioned before, pain medications can help reduce that risk and entice them to have a better appetite. But if you're noticing by nightfall that your rabbit still hasn't eaten, you may want to go ahead and start a course of critical care. You can offer it outside of a syringe first, since hopefully your rabbit will be used to it from the day before and they'll be open to eating some more. And if they don't want to take any, you will have to force feed using a syringe. I will do a video on syringe feeding later on. Now, if you're still having to force feed your rabbit by the following evening and they're still not eating hay or anything, you may want to give a call to your veterinarian and see if they have any options for you, because your rabbit may be going into GI stasis. After surgery, make sure that you always have fresh hay and water available. You will also want to keep an eye on your rabbit's incision site during your post-op care. If you're seeing excessive redness, oozing, or bleeding, you'll want to give your veterinarian a call right away. And I also wanted to address a couple of questions that I got on Facebook that people asked me to address in this video. So a few of them included before and after care, which I discussed. Hopefully I covered everything, but let me know if you have comments below and I would be happy to answer them for you. I also addressed what issues and problems to look out for afterward. Again, if there are any other questions, please definitely let me know down below. Someone also asked if fixing will help with litter habits, and as I mentioned earlier in the video, yes, fixing your rabbit will help with litter habits. However, there are some underlying health conditions that can cause litter problems, so you want to keep an eye on your rabbit's progress using their litter box after surgery, and if the problems are persisting, you may want to consult with your veterinarian. And the last question that I wanted to discuss is convincing your parents to get your rabbit spayed or neutered. I know that a large portion of my viewers and a lot of rabbit owners are actually children, and kids are awesome these days. You guys are learning so much and watching videos like this and other awesome YouTubers that are sharing their knowledge, so it's really great that you're doing your research. And if you're having trouble convincing your parents to spay or neuter your rabbit, I highly suggest having them check out this video. Just watch this video with them, sit through it with them, and let them take in the information themselves. There are a huge amount of benefits to having the procedure done, and it is highly, highly recommended with veterinarians that you do have your rabbit spayed or neutered. And it also drastically improves their lifespan. Hey, editing me here. I also just wanted to throw in this little section for parents to hold yourselves accountable as well. If you got a pet rabbit for your child and you didn't do your research and now you're learning that spay and neuter is standard practice, that it will improve the quality of your rabbit's life, it will improve their behavior, and reduce unwanted behaviors and odors, that's research that as an adult, you're responsible for taking care of as well before you get a pet for your child. So it's really unfair to allow your child to get a pet or to get a pet for your child without actually doing your own research up front. This isn't me trying to be judgmental at all, but I constantly get comments from kids and teenagers saying, my mom or my dad or my parent will not allow me to get my rabbit spayed or neutered, or my parent will not take my rabbit to the vet. And there's really no excuse for that as an adult. This is your child being more responsible than you are. So I think it's important for you to set a good example for your kids and to take responsibility when you have made a decision, made a commitment to have a pet. This is your chance to show your child how to follow through with a commitment properly and how to properly take care of an animal. So, of course, this is a personal decision. There are lots of considerations that I talked about in this video, but as an adult, it's really your responsibility to take responsibility for your actions and take care of your pets properly. The rabbit might be your child's pet, but at the end of the day, you are the adult in this situation. You're most likely the one with the money, and this is something that you should definitely have looked into before you got a pet rabbit, and now this is something that you're responsible for dealing with. So if you are a kid or a teenager checking out this video, I just recommend you sit down and show this video to your parents or watch it again with them and have an open discussion about what's best for your family and your situation. And the last question that I got was, should I keep my bunny warm or cool after surgery? A heating pad is a good option for post-op care just to offer some more comfort. If you notice that your rabbit is really uncomfortable, a heating or cooling pad may help them. So you could offer them both and see which one they prefer. You can also create your own cooling pads by freezing water bottles and wrapping them in a pillowcase or some type of fabric and seeing what your rabbit prefers. I like to offer both because we're never really sure what they need for comfort, and rabbits can be sensitive to heat. So if they're not feeling well and they're feeling feverish in a sense, they may want to avoid the heating pad, and if you offer them both options, you can see what your rabbit would like. So that concludes my spay and neuter video. I hope that this video was helpful and informative for you, and please let me know if I missed anything down below or if you have any questions that you would like me to address. I will be happy to read through the comments and have a chat with you. Now, I know I mentioned GI stasis several times during this video, and I will be covering GI stasis in next week's video, so make sure that you tune in for that. The best way to keep up with me is by subscribing and hitting the bell icon here on YouTube. You can also follow me on Instagram at bunniesathome.blog and TikTok as well at bunniesathome.blog. So I hope to see you guys around. Thanks again for watching today's video, and we will see you next time. Bye!